So I'm here with Nicky Bargabos. She's an RN and clinical specialist with Blue Chip Medical Products, and we're here to talk about the Airus, which is the Air Fluidized Therapy System. And maybe we could start by kind of describing the system and what sorts of patients it's intended for.
Absolutely. The Airus is a Group 3 air fluidized bed. It is meant for the flat patients, the skin graft patients, burn patients, as well as the stage 3 and stage 4 pressure ulcer patients that have not healed on a Group 2 support surface prior to going back into a hospital setting. This is the piece that keeps them in the home setting, and it increases blood flow to the tissues to help them heal a little faster. It does 100% flotation of the patient, so it keeps the blood flow from being impeded with other surfaces, as well as promotes healing to that wound area. It is the last step for wound healing when it comes to the surface that the patient lays on.
And I have to say, it's a pretty incredible thing that's going on here. So this is silicone beads.
Correct. This is silicone-coated glass beading with air that's being forced up underneath to create a fluid-like motion out of a solid piece. It's
pretty amazing. And then this material, this layer goes over it, and that's what the patient is laying on.
Absolutely.
And the media itself, because you have air that's moving this through, the idea is to wick the moisture away from the patient, correct?
Correct.
And then so do you have to go through every certain in a certain time frame and sort of remove the media that has absorbed the moisture, or how does that work?
The nice thing is in the home care setting, you really don't have to do any maintenance to the inside of the bed.
Oh, okay.
Once the patient is discharged off the surface, then we can clean the insides. One is we do take good care of the, for lack of a better term, we call the waste that goes to the bottom cookies.
Okay.
So the cookies, I know, I'll never eat a chocolate chip cookie again. But it is, there's a large screen inside which is lifted. The cookies are there, you throw them out.
Oh, okay.
Put the bed, the beading back into the bed, turn it on the clean setting. It runs for 24 hours and it will disinfect the beading as well as the inside of the bed.
Oh, wow. And then for the surface that the patient lays on, I take it that's launderable, or how's that cleaned?
It is launderable. Sometimes our patients, because it is a white sheet, can get soiled with staining.
Oh, okay.
So therefore, it does have a replacement sheet, and each bed is actually delivered with 2 sheets, so you will have a replacement.
Oh, okay. All right, great. As far as the materials are concerned, so as I understand it, once this media, these beads are out of the bed itself, it's pretty light. It's like what was it, like 80 pounds or something like that?
Yep. The base itself weighs 75 to 80 pounds. The beading itself is where the weight comes into play, but it is delivered in 5-gallon buckets.
Okay.
So it makes it very manageable for someone to deliver. It does take 23 buckets to fill the bed, so it is a little time-consuming, but well worth it.
For DME providers, how would they be providing this to patients? Would they be working with specific referral partners, or how would that work?
Actually, there's 2 ways they can do that. One is if they already have a good support service market, say they do those Group 1, Group 2 services now, they wouldn't really need to pull on anyone else besides their current clients. Mm-hmm. Because most patients that are on a Group 2 support service have not healed within a 30-day time frame. Therefore, they could get converted over to a higher-end treatment piece and go onto an air fluidized system, or change their model completely and start calling on wound care clinics, rehab centers, burn centers, and plastic surgeons that do flap and graft surgery.
As far as reimbursement codes, do you happen to know the reimbursement codes?
I do know the reimbursement code. It is in EO 194.
Okay.
It does reimburse, depending on your state, somewhere between $2,500 and $3,600.
Gotcha.
So it is a very high-end reimbursement. However, you do have to keep track of your patients with monthly notes. Because Medicare doesn't want to spend $3,000 a month for a patient that does not qualify for it. Let alone, you don't want to lose track of your service because it does fall within that 13-month capped rental piece. So we do need to be a little more mindful with this than we do most of our other products.
Gotcha. Terrific. Well, again, thank you very much.
Thank you.